My presentation will be not like always related to the biochemistry, to the pharmacology, to the fantastic mechanism of action that so far we discovered thanks to the group of Professor Bocci, Professor Borrelli is here. So years of study. Also with Olga Sonia, that I never forget for in my life, because she was the first to tell me, Lamberto, I was a scientist, just a medical doctor looking to receptors, medicine, drugs, receptors, agonist and antagonism. And she told me, look, it could be possible that this gas, a moderate, adequate oxidative stress, can give back a beautiful response. 35 years ago, more or less. We were crazy. We were crazy. Now we know that we are not crazy. We were curious. And to go deeply, to know if this could be possible. And I show you later what we discovered during these years. And why we need to take care of all the knowledge that we had before, thanks to many scientists that work hardly to collocate, to put us now where we are. But something is not properly ruled. And just because the people that is here knows very well what we can do. You are high quality doctors. But sometimes we are not so well organized to defend the image of ozone. So in one of these points, I talk about we are ghost doctors. So in many countries in the world, so Lamberto Re in Italy is a doctor well known, delivering medical ozone to a lot of people. But ozone is not allowed. I don't know. And so there is no rules, no law, nothing that can defend my dignity. I want to be recognized as doctor delivering medical ozone. So there are some, because this is an epic moment. There is a lot of people, lot of customers that hearing the friend that was treated with ozone and he or she felt fine, fantastic. I want to try. So the curiosity and the request from the people is very, very high in this moment. I show you later some numbers that are incredible. 70,000 autohemotherapy measured blood ozonation in the last 20 years. 70,000. Increasing after COVID. So the numbers we see not only in our case, but also in many centers in Italy around the world show exponentially, demonstrating the sheer demand for this treatment. So we are not ruled. We have some scientific evidence, but we are ignored. And now I am really very happy for the work of Antonio in Brazil, because it is more important that the medical associations, our colleagues, medical doctors, they need to start to cooperate. But we must be able to explain exactly what we are doing with this gas. But you know that the quality of life increases. So in addition to be happy for this, our responsibility increases. We are more responsible now in this moment. So it is very important the work done in Brazil by Emilia and Antonio, and also here in Romania, because also this country is going, as Gabriel told us before, toward the right direction. And why I want to tell you about this point, no? And I told you the problem sometimes is between us. So despite the work, the wonderful work of Antonio, there is some people that say, but we needed this recognition. It's absurd. Like some of us, and as you know, when I speak about ozone, I am in love with ozone. But I don't want a divine recognition. Some people think that ozone don't need to be recognized. And this is very bad, because that means that we are not responsible of what we are doing. So, on the contrary, because the above, I believe the self-regulation and political recognition now are mandatory, but depend is up to us. In the absence of adequate legal provision, this self-regulation, because waiting for this regulation that state, okay, you need to have this medical doctor or dentistry or nurse, I don't know, and you need to have 3 years of study and 2 years of frequentation and practical and clinical activity. And after you can start, but you can start using, for example, generators of good quality. So some rules that decide, but in the same time, because we don't have official rules, we need to do our rules, self-regulation. So this is very important, and escape from our status. I don't like to be ghost doctors. When I was president of FIO 4 or 5 years ago, I called directly the sanitary commission of Cardarelli or Careggi, and I would like to see one paper, one document where it is clearly written that ozone therapy is done in this hospital. Does not exist an official document, but we know that in this hospital they deliver ozone for back pain, for disc herniation. So why they need? Perhaps some people is afraid, I don't know, but most of the problem is from our side. So it was very sad to find no mention of ozone as medical treatment. So this is the main reason why it is essential that our work must be recognized and not hidden, for reasons that, in my opinion, undermine our dignity and our medical profession. Improved organization of international society. In Italy, we have 4 society. 4. What does it mean? That each ozone association have a rules different from the other one? When I was in the university, in the department of pharmacology or neurophysiology, there was in Italy, in all the country, but also in the world, only one society, pharmacological society, Italian Pharmacological Society, Italian Oncological Society, Italian Physiatric Society, one. We have 4. So we must be, so I am Italian, so I am criticize myself. I don't say Romania or Brazil, Italia, and I am Italian. It's crazy, but it's difficult. I try sometimes stay together. Okay, you think it is. I remember many years ago when I was young, one professor, imagine to our students, if all the people have the same meaning, the same thing. Every people is different. My idea also, if all together are here with the same conviction about ozone, but each of us is a little bit different. But this does not mean that we can justify to be, one society, Lamberto, one Emilia, one Olga, one you, one you. No, stay together, put together all the points that can, as essential for us, just to give our image strong outside our corporation. So this is the attempt that I suggest in all the countries where there are more than one society. And I ask also to Lale, as World Federation president, just to do an effort. And they can accept inside World Federation just one society. This is a point that we have to discuss. But it is important to avoid conflicts and to offer the best organization. So this is another particular, as I told before, I am the first curious medical doctor, because any scientist is curious. So I don't close nothing regarding the possibility to have new clinical approach. But we are two considerations now. We have a lot of studies, clinical studies and scientific evidence about the idea of a small oxidative stress that give back an antioxidant response through NRF2 and other metabolic pathway. It is clear now. How we can rationally, scientifically explain the one medical activity, one positive activity on the hill of the people, giving more. Like I come back to pharmacology. In the pharmacology, we have the dose-effect relationship. So more dose, more effect, more dose, more effect. Here it's not the same. Or perhaps I'm wrong, I don't know. You know, if you give me 40 years of study, like we have for the thesis of oxidative preconditioning, that Olga know very well. Okay, perhaps I'm wrong, but you have to convince me and all the other people about this. And after go. But now we are in a critical situation, very critical, where the business, okay, is a bad word, I don't like, but okay, it's a business, because if our quality increase, also our business increase, because more customer, and also the increase of manufacturer increase. So quality, organization, and don't leave the old path for new path. For the moment, or till we don't have 100% safety for the patients. We must be sure the safety of the patient now is the first. Because one people in any place of the world that die during or after treatment with ozone will be a big problem. So this is very important. Also, I remember Professor Bocci always asked us, please increase clinical, try to do. I know that it's not easy because we don't have a sponsor, but one day, the reason why the World Federation started with the new constitution is to help, to support idea, just to try to do clinical evidence and more knowledge about the fantastic effects that we can see every day in our clinic. So we know that we are able to do miracle with ozone. I am the first to think, but please, also, we need to have to defend our dignity. I don't like to tell the people, or to another doctors, this patient have this problem you can solve, I can solve for it. I can say, I can try to help you. Ozone is an integration. We need to integrate. Why oncologists don't come to us to ask, Lamberto, or some oncologists is starting to do this, a cooperation. So neurologists, we know that ozone is wonderful for reducing the damage or the age of the brain and the neurons. I am sure 100% that in Parkinson we could have beautiful, but if we have the cooperation with the neurologist. So neurologists then cooperate, send to me the patients before starting the pharmacological therapy, because we know that there is only one thing sure. With the pharmacological treatment that we have now, in this moment, the patient die worse. So why we don't try pharmacological therapy, ozone and pharmacology, and ozone alone? But you know why they don't want? The first thing that they ask to you are, who is the sponsor? To send, to cooperate, to work on 10 patients, they ask for money. I try now to do some work because it is not easy, because being not a direct action, the action of ozone is an indirect. So you can imagine you give a small stress, you activate NRF2, the NRF2 going the area receptor, gene area antioxidant response elements. The gene start to produce its protein or enzymes. And after this, the final clinical results. There are several. And also, these steps are usually different from people to people, because I don't know if I have time, but in my presentation, I show you also some supplements that are important. So you know that, for example, and we have a paper with Olga that also increase the gene that produce superoxide dismutase is activated, is upregulated. But if you don't have selenium, coprum, magnesium, these enzymes does not work. So it is important that there is an equilibrium with this. So our business is also the business of manufacturers, and it is very important also that the World Federation launched many years ago a section dedicated to certifying the quality of generators. So we are not, we don't want to be the friend of one company. All the companies are okay. We would like to verify, for example, the quality. You need to think one thing. When you have your patient in front of you and you start to treat him, the first thing that you put inside his body, you put one gas that you had to produce just a few minutes ago, 20 minutes ago, because otherwise, ozone come back to be oxygen. So the quality of this process is fundamental, because it's the first. I don't want to know how is the price, 20,000 euro, 15,000 euro, 10,000 euro. I want to see the quality. The component inside are ozone resistant. There is photometer. No, okay, you can, no problem. Could be a good machine, but each 6 months or 1 year, you need to check again. So small things, but we need to start from the fixed point. And this must be clear. This World Federation don't want support nothing, nobody, but just only tell, give me of how you build this kind of machine, and we can say to you if is inside the parameter for the safety of the patients. And every time you need to think that that patient could be your wife, your son. If we think this, we don't like to put inside this body something that is not absolutely pure. Okay, so I finished. Now I want to, I have time, no? So I want just to remind one thing that is fantastic to my opinion, no? When one doctor asked me, but doctor, could be possible also in one person increase one function, in another person decrease, like an agonism and antagonism. But this machine, that is fantastic, this machine can modulate gene expression. Modulate gene expression. So one gene, for example, that is producing a monoamine oxidase or some other activity inside the cells could be up or down regulated. If it's up regulated, you have a physiological agonism. If it's down regulated, you have a physiological antagonism. Fantastic. Fantastic. I don't need to give beta blockers to reduce the earth frequency or adrenaline to increase from outside, acting on the receptors. I modulate with an epigenetic mechanism the activity of the gene. But Lamberto Re is not so crazy to think that there are some fabula. There are papers. And now we know that we are inside this group because not only ozone is able to activate NRF2, not only, but now a lot of clinicians around the world, they are studying the potential of this because it is, I heard yesterday in the television, just some people, some interview, because this will be the pathway, the future, I am sure 100%. Because so far we need a lot of information that we don't have now. Some small step, like this McCord say. McCord, I want to come back here. 2,000 genes, but regulate the expression or repression. And the fluidity of gene expression is incredible. It is very difficult. I was a very good scientist because I was in love with research. But if you ask me, please, give me a protocol to demonstrate this kind of effect. It is not easy. But does not mean that it's impossible. But if we don't try, sure, it's complicated. Stop. No, it's complicated. We need to look, to study. Read every day. And so you can see it is complicated. So far I saw these slides 50 times, but I don't understand exactly because it's very difficult. But this is not Lamberto Re. This is the group of McCord, Iverson that discovered that between the 2,000 genes, there is one gene that tissue remodeling. One gene that ruled the tissue remodeling. So you know most of the people, especially women, that are treated with measured blood ozonation, after a few times, doctor, my skin is bad. Sure. There is one gene that is up or down regulated by perhaps a small oxidative stress. So in this paper, I suggest to read this, but also they conclude we need more human clinical trials to utilize and understand what has been learned in the laboratory regarding the potential therapeutic. The problem is that so far we are thinking that one drug, one problem, one drug, €1. No, me, €10. One problem, one drug, €1,000. One problem, ozone, only one. So this is the main problem, but no problem. I don't like the critics and to cry on myself. No. I am not the people that I want to cry to myself. It is correct. Business is business. But the health of people is another thing. So integration is very important. I use this kind of integration because, as I told before, if you want to reach the best response, you need to check. For example, arginine. We know, for example, there is another paper published by Olga Sonia that includes nitric oxide synthesis that from arginine and towards citrulline activate and produce nitric oxide that is very fundamental for the microcirculation. But if you don't have arginine, because, for example, in your food every day you don't have enough of this, you need to supplement. And perhaps you can come back with ozone to have the best results. So don't worry if 10 people give 10 different responses. It is normal. And it is not like pharmacology. If I give adrenaline to 10 person will increase the heart rate. Hi, professor, you are wonderful. Yes, full professor tomorrow because I have a lot of this paper. In the acute phase, you can use this. But in the chronic, no. In the chronic, you need to fix the problem inside your body. So also there's some supplementation. In 30 years of our clinic, I want to show you, we treated 70,000 patients, and most of them with systemic, that now we last year in our declaration of Sao Paulo, because autohemotherapy or GAET, great autohemotherapy, we do prefer measure blood ozonation. Measure blood ozonation, simply. And we treated most of them with systemic, also other with injection and insufflation. Main condition, preventing anti-aging. Preventing anti-aging, one of the first. We need, don't forget that medical ozone treatment is mainly indicated in integration with other specialties and in the prevention. So I told my patient, speaking with them because every day I speak with them, explaining, you need to come for all your life because it's a new lifestyle. And if you want to maintain this lifestyle every month, you need to do this kind. It's like gene. So you can say one people, doctor, I want to do activity, physical activity, just to stay better, just for 1 year. No, for all your life. You decide the time between each treatment. So most of them, and lifestyle improvement, and also chronic non-fibromyalgic, and only 80 people for fibromyalgia, because there are good results sometimes. Treatment related to gender, and you can see, for example, for chronic fibromyalgia, we have mostly female, and in preventing anti-aging also, and in lifestyle improvement, we have an increase of male. These data are all 70,000 treatments. And you can see here, for example, for the chronic pain, non-fibromyalgic, in the fibromyalgic pain, you can see that the fibromyalgic is in the male have no beautiful effects, but in the female, you can see the fibromyalgia in the women is reach better result, more than 50% of good results. And this is the increase of the treatment after 66,000, and after COVID, because most of the people now with post-COVID syndrome, they receive benefit effects. And VFOT approved procedure, rectal insufflation, minor blood ozonation, measured blood ozonation. Clinical benefits, okay, so this is comments and conclusion. So the discovery of this NRF2 that could be modulated by ozone is the key of the results that we can have, and the hope that we can give to the people coming to us. And the relatively low cost could represent an important strategic element also for the Minister of Health. The Lancet report the global life expectancy has increased over total 2 years. So you can tell to the manufacturer of medicine, don't worry. You can sell less medicine, but if my patient lives 10 years more, you can recover this. You can sell more medicine during 10 years more. So the help and supervision of supranational societies, such as World Federation, no profit and without conflict of interest. So you know there are 2 international societies. I want one society, me, I am nothing now inside. I don't have any rules, but I am with World Federation because the World Federation warrant me the best of this. High quality, good people, and no conflict of interest. If we want to grow, it is very important that we maintain constant this aspect. Okay, so sometimes we were called also with Maria in Europe. And it was really first step, but some curiosity there is only at this level. So thank you very much all, and so be strong.